Welcome back to Eye Health Insights. I'm Dr. Joseph King, and today we're talking about something many people experience at least once in their lives, those tender, annoying eyelid bumps called styes, and the more stubborn, sometimes confusing chalazia. If you've ever awakened with a painful lump on your eyelid, or you've noticed a firm bump that just won't go away, this episode is for you. Here's what we'll cover today: what styes and chalazia actually are, why they form, and how they differ, and how to treat them safely at home when you need to see an eye doctor, and what options exist when a bump just won't resolve. Even though people use the words interchangeably, styes and chalazia are two different conditions, related but not the same. A stye, also called a hordeolum, is an infected oil gland in the eyelid. It's red, painful, and it often looks like a small pimple at the edge of your eyelid. Styes can cause swelling, and that makes your whole eyelid feel sore. A chalazion, on the other hand, is not an infection. It's a clogged oil gland that forms a firm, painless lump deeper in the eyelid. Think of it like a blocked drain. Oil backs up and then hardens over time. Both come from the meibomian glands, tiny oil-producing structures that keep your tear film healthy. When they get blocked or inflamed, you can end up with one of these bumps. Let's start with why this happens. Most styes begin when bacteria get trapped in an oil gland or eyelash follicle. This causes a small, localized infection. Chalazia usually start as meibomian gland dysfunction, when the oil becomes thick and slow flowing. That oil can plug the gland, forming a firm lump. Risk factors for both include chronic eyelid inflammation known as blepharitis, rosacea, seborrheic dermatitis, wearing old or contaminated makeup, poor contact lens hygiene, and rubbing the eyes. And just like with acne, some people are more prone to these bumps simply because of their skin and oil gland type. One of the most helpful things for patients is to understand the key differences. A stye is painful and tender, red and swollen, usually at the edge of the eyelid, and it may look like a pimple or a small boil, and it can cause tearing or light sensitivity. A chalazion is usually not painful. It appears as a firm, round bump deeper in the eyelid rather than on the edge, and it can grow slowly over weeks, and it sometimes causes blurry vision if it's large enough to press on the eye. A chalazion often forms after a stye, once the infection settles, but the gland stays blocked. Now, what can you do about them? The single most effective treatment for both styes and chalazia is warm compresses. Heat softens the thickened oil and it helps it drain. I recommend a clean, warm, but not hot, washcloth applied for 10 to 15 minutes, 2 to 4 times a day. Massaging the eyelid gently afterward can help encourage drainage, but never squeeze or pop the bump, as this can worsen the inflammation or cause scarring. For styes specifically, because they're infections, careful hygiene is important. Avoid eye makeup until it resolves. Don't wear contact lenses. Use lubricating drops for comfort, and clean the eyelid margin with gentle cleansers. Most styes will improve within a few days. Chalazia often take a few weeks. Some bumps don't resolve with home care alone, and that's when I encourage patients to come in to see us. We may prescribe antibiotic ointment for styes, steroid drops for chalazia with significant inflammation, oral antibiotics if there's surrounding cellulitis, or in-office procedures such as a tiny steroid injection. In cases where a chalazion is persistent or quite large, a quick minor surgical drainage can remove it. It's done under local anesthesia, and it usually takes just a few minutes. It's also important to be evaluated if the bump keeps coming back in the same spot. You notice changes in the eyelid skin, vision is affected, or the whole eyelid is swollen and painful. Rarely, persistent bumps can mimic other conditions, so an eye exam ensures nothing more serious is going on. Patients often come in feeling embarrassed, like they caused this by doing something wrong, and I always reassure them. These bumps are incredibly common. Even with perfect hygiene, they can still happen. Another frequent question is, will this go away on its own? Styes often do. Chalazia sometimes do, but they can be stubborn. If it's affecting your comfort, your appearance, or your daily life, it's absolutely reasonable to treat it. And finally, is the procedure scary? It's normal to be anxious, but most people are surprised by how quick and gentle it is. Many tell me afterward they wish they hadn't waited so long. Warm compresses and good eyelid hygiene are the foundation of treatment for both styes and chalazia. But if a bump is painful, persistent, or interfering with daily life, an eye exam can help you get relief quickly. Thanks for watching Eye Health Insights. Take care and see you soon.